first two cranial nerves are olfactory and optic. Olfactory is smell, so you can have them smell like an alcohol prep pad, a sandy wipe, the grass, some smelling salts. Just make sure that they don't like jerk their head back. Can you smell it?
Mm-hmm.
Okay. And then cranial nerve number 2 is optic, which is just sight. So can you read that sign on the door?
Please do not lock this door.
Can you see what color that trash can is?
White.
Okay. You just make sure that they can see and that their vision is adequate. So cranial nerves 3 and 4 are oculomotor and trochlear. So cranial nerve 3, oculomotor, is for blinking and pearl. So just blink for me. Good. And then pearl is making sure that their pupils react equally to light. So you want to shine a light in their eye and do it bilaterally and make sure that their pupils dilate, and when you remove the eye, that they don't dilate. Good. Trochlear is inferior and upward eye movement. So usually you do all the eyes with the shape of an H. So follow my finger. Good. Cranial nerves 5 and 6 are trigeminal and abducens. So trigeminal is mastication or chewing. So just make sure that your patient can bite. Good. And abducens checks lateral eye movement. So you want them to follow your finger. And you can bring your finger out pretty far. And just make sure that they can follow it all the way laterally. Cranial nerves 7 and 8 are facial and vestibular cochlear. So facial tests for equal sensations on both sides of the face. Make sure that they feel the same when you touch them. And then they also need to be able to do facial expressions. So can you frown for me? Good. Raise your eyebrows. Good. Make a funny face. Good. And then vestibular cochlear is hearing and balance. So you can perform a best test on them if you have the time. But also hearing equal on both sides. You can snap. You can just have them walk. You can observe their gait to make sure that their balance is adequate. Cranial nerves 9 and 10 are glossopharyngeal and vagus. Glossopharyngeal is the gag reflex. Not going to gag you, but it's also swallowing. So can you swallow? Good. Vagus is speech, talking, and also smiling. So what is your name?
Amanda.
Good. And can you smile for me? Good. The last two cranial nerves are accessory and hypoglossal. So accessory, you're checking for the traps. So you want them to do a shoulder shrug and you're going to resist them. Shrug up. Good. And then for hypoglossal, you just want to make sure that their tongue movement is normal. So stick out your tongue, wiggle it around. Good. Reflexes go along with myotomes and dermatomes. So the lower extremity reflexes are the patella and the Achilles. So the patella is L4. So can you bring your leg out? Find their patella tendon. Relax. Stabilize on the femur. And apply force, and her leg should kick out. And then the Achilles is S1, so you put them in neutral in your hand. Find the tendon and apply force, and you should feel the foot push down on your hand. Upper extremity reflexes are the biceps, the brachioradialis, and the triceps. So the biceps is C5. Can you flex for me? You need to find the tendon and then good. brachioradialis, find the tendon again. Good. And then triceps. Relax. Give me room. Push out. Once again, find the tendon. Good. The upper extremity dermatomes, you're going to start with C5, and this is just the deltoid region. So you palpate the deltoid region. C6, come down here and go to the thumb and the pointer finger. C6, shooter. C7 goes down to your middle finger. C8 comes down to the last two fingers. And T1, you can remember, no one ever gets sun right here, so T1, no sun. Upper extremity myotomes, you want to start with C5, which is the deltoid region, so bring your arm up. I'm going to push down, don't let me. Good. C6 is a bicep crawl, so try to bicep crawl. Good. Stay up there. C7 is tricep, so push down. Good. C8 is honor deviation, so push your hand out. And you can also have them shake your hand. Good. And then T1 is interossi, so you check the strength of their fingers and make sure that you always do this bilaterally. So lower extremity dermatomes, L1, L2, L3, L4, L5, and S1 down the back of the leg. Lower extremity myotomes, you can knock out L1 and L2 with a straight leg raise or hip flexion. So bring your leg up. Good. So that's L1 and L2, swing over. L3 is done by checking the extension. Good. L4 is done by checking dorsiflexion. Good. L5 is big toe extension. Extend your toe. Good. And S1 is plantar flexion and eversion. So push down. Good. Come out. Good. So for pulse and respirations, you can do them together. And I like to not tell the patient that I'm counting their respirations because it might make them breathe differently. They think they have to breathe slower or faster. So for the first 30 seconds, I take their pulse. Make sure you don't use your thumb because your thumb has its own pulse. So you find their pulse, count the beats for 30 seconds, and then the second 30 seconds you can watch their chest rise and fall and count their respirations. And at the end of the minute, you multiply both numbers by 2 and you have your pulse and your respiration count. There's a couple of different places you can take the pulse. You have the radial artery, the brachial artery, the carotid artery, and then the dorsal pedal.